Hello everyone, this is Dr. Shrey Bhatia and welcome to my channel. So today is the weekend and I thought of bringing top 5 medical updates of the week for all of you. So let's get started. Number 1, this week we have seen a major approval of a drug to treat diabetes. I'm talking about Manjaro. US FDA has approved Manjaro or tirzepatide injection to treat type 2 diabetes. It's a new once weekly GIP and GLP-1 receptor agonist. That means it's a molecule that is going to activate GIP and GLP-1 receptors in the body. The results from the clinical trial on Manjaro are amazing. It has proven its superiority in reducing HbA1c levels against all the competitors. And while it's not a weight loss drug, the participants treated with Manjaro also lost up to 11 kgs of the weight on average with the highest dose of 15 mg of course. The side effects were reported only in 5% of the patients treated with Manjaro, and these were commonly related to the gastrointestinal tract only, like nausea, diarrhea, decrease in appetite, vomiting, and constipation. Number 2. A study has been published in journal Nature to investigate whether a low carbohydrate diet has any beneficial effects in the cases of colorectal carcinoma. From the past studies, we know that the Western diet, high sugar diet, and excessive consumption of animal protein, especially red meat, increase the risk of colorectal carcinoma. So, talking about this study, it is done in mice to investigate whether a low carbohydrate diet has any benefit in cases of colorectal carcinoma. So in this study, the researchers found that the low carbohydrate diet, like ketogenic diet, are associated with reduction in the tumor growth in colorectal carcinoma. The low carbohydrate diet, like ketogenic diet, it produces a molecule, namely beta hydroxybutyrate, or we can call it BHB. It is an alternative source of energy produced in response of low carbohydrate diet. So BHB suppresses intestinal tumor growth. Therefore, if we supplement the current therapy for colorectal carcinoma with BHB, the outcome could be better. Since this study was done only in mice, more studies are needed on this topic, especially in the human subjects. Number 3. Is your mental health condition related to risk of cardiovascular diseases? The latest study published in journal Biomedical Engineering has come up with some of the new findings on this topic. It is a known fact that the mental health conditions alters body autonomic nervous system, or we call it ANS. So autonomic nervous system comprises the cells that maintain body's equilibrium, including stable blood pressure. If the autonomic nervous system is dysfunctional, it may increase blood pressure variability or fluctuation in the blood pressure. Therefore, to say whether ANS is dysfunctional, we can measure BP variability. So if BP variability is high, it means ANS is not working properly due to some reasons. It is also known that high BP variability is associated with increased risk of cardiovascular diseases. So here I'm talking about a latest study published in journal Biomedical Engineering. The results showed that the people with depression or anxiety had high BP variability. It means that the mental health condition affects ANS and thus makes this individual more prone to cardiovascular diseases. With this information, we can say that the early diagnosis and treatment of mental illnesses may prevent diseases associated with autonomic dysfunction and thus also reduces the chances of cardiovascular diseases. Number 4. The development of oxidative stress in the body is associated with damage to the body's cells, including brain cells. One such condition related to the oxidative damage to the brain cell is called Alzheimer's disease. It is a type of dementia associated with short-term memory loss, language and decision-making difficulties. So in this case, the consumption of antioxidants in the diet may reduce oxidative damage to the cells and thus prevent occurrence of dementia like Alzheimer's disease. In a study published in the journal Neurology, the researchers tried to establish link between the level of antioxidants in the blood and the rate of occurrence of Alzheimer's diseases or other dementias. The researchers measured levels of various antioxidants including vitamin A, C, E, several carotenoids in the participants' blood. According to the study, the individuals with higher antioxidant in the blood had lower chances of developing dementia. The antioxidants, namely carotenoid, lutein, and zeaxanthin, were present in the higher quantity in the individuals with a lower rate of dementia. These antioxidants are present in green leafy vegetables like kale and spinach. So this study clearly indicates if the people consume diet rich in specific carotenoids, they may be at lower risk of developing dementia with advancing age. Number 5. The American Academy of Sleep Medicine recommends that adults get at least 7 hours of sleep each night to improve their health. Poor sleep patterns and duration have been linked to increased risk of metabolic diseases, weight gain, and obesity. An individual who lacks good quality of sleep may also have an increased appetite for high calorie, high carbohydrate diet linked to the weight gain. The researchers with University of Copenhagen studied the quality and duration of the sleep in 195 adults living with obesity. The results from the study showed that the weight loss is associated with improved sleep quality, and after the initial 8 weeks restricted calorie diet for the weight loss, these individuals showed improved sleep quality by 0.8 global PSQI score points, and also the sleep duration increased by 17 minutes per night. Although this finding was not tested with the placebo-controlled trials, it indicates that the individuals with poor sleep may benefit from the sleep pattern support and weight loss. So guys, hope you have liked top 5 medical updates of the week. For more such medical insight and health information, subscribe to my channel. See you next time.